Our next speaker is currently the National Mental Health Commissioner, has extensive experience in psychology and has a strong commitment to helping others. Her primary areas of focus are issues facing mental health and wellbeing and suicide prevention, particularly in the workplace. She takes an evidence-based approach to problem solving and social investment. She has more than 25 years of commercial experience with companies, including Macquarie Group and Ernst & Young, working in accounting, finance and organisational psychology. Specifically, she has worked in trusted advisory roles with some of Australia's leading CEOs, managing partners, ministers and chairs. She is also a friend of Carers New South Wales and a carer. Please welcome Lucy Brogden, who will speak about the secret life of carers, out of the shadows, carers in the mental health and suicide prevention sector. Welcome, Lucy. Thank you.
Thanks, Eleanor. Thank you very much for having me today. I would like to start by acknowledging that I'm coming to you today from the lands of the Guringai people and elders past, present and emerging, and particularly in the context of mental ill health, acknowledge the deep understanding that our First Nations people have when it comes to social and emotional well-being. And as is the tradition in the mental health space, we like to acknowledge those with a lived experience and those that love and care for people on that journey. Today, I thought I'd share a little bit with you about my own journey as a carer and then the work of the National Mental Health Commission in the context of our work with and for carers in the space. It is often not surprising that many of us start our carer stories by talking about the fact that we came together with a loved one for better, for worse, richer, for poorer, etc., etc. And my story is not unique in that regard. We were a young couple on a very stellar path, enjoying life. And then I entered what I call the silent panic, but in the context of this topic, it might be the secret panic. I was worried about changes in my husband's behaviour. He was either sleeping all the time, not sleeping at all. He was eating too much or literally not eating at all. He was irritable. Nothing seemed to be bringing him pleasure. He was very high profile at the time, working in politics, and I felt that I couldn't share my concerns widely. So it was a very secret panic that I was living in at the time. I'd also just started studying psychology, so I thought I would try and do the research myself, and did all the wrong things in terms of trying to broach the subject of my concerns with him. Not being able to really engage in that way, I thought I would do my own efforts to self-treat or treat him, and looked at foods high in serotonin, which I thought might help lift his mood. Bananas are particularly high in serotonin. And so our staple diet became one centred around bananas. It was only years later that Professor Gordon Parker at the Black Dog Institute said to me that actually he'd have needed about 20 kilos of bananas a day to make a difference. And while I accept that, it's intrigued me that nearly every time I talk about and share this anecdote, people in the audience say that they did exactly the same kind of things for the person that they loved and cared for. What I do know about being a carer is that when my husband's well, he's very well. And when he's not, he's very unwell. And there's no straight line trajectory in caring for someone with a mental illness. It's a lot of ups and downs, but we are very fortunate that our journey has been predominantly upwards with a few hiccups along the way. What I have found about caring is that there are some silver linings. And I'm not sure what the word is, but what we found is that it has taken our relationship to a whole nother level. And maybe these are the secret insights that many people online will be sharing today. And it's in the people that we've met. It's in what we've learnt together, how we've grown together as a couple. And I feel quite privileged to hold them and wish I could share them with others, but at the same time, I wouldn't wish necessarily the journey on others. And so it's an interesting place to be, but I'm very grateful that we are where we are today. Having experienced all those issues, I was very pleased a number of years ago when the previously Hunter Institute of Mental Health, now Everymind, asked me to be their patron for Partners in Depression. And this was really a program based on the great work out of Carers New South Wales to tailor services and supports around those that loved and cared for someone with depression. And it was a great program and a great face-to-face program, providing some incredible psychoeducation, but importantly social support. And I'll come back to this a little bit later. But it is from that role that I was asked to join the National Mental Health Commission. And just briefly, the National Mental Health Commission is an executive agency in the Commonwealth Department of Health. And its CEO reports to the Minister for Health, Greg Hunt, and there are generally around 11 commissioners providing their independent advice to the Commission. And the commissioners come from a diverse range of backgrounds. We have lived experience, consumers and carers. We have people working on the ground in social support and housing. We have academics, we have clinicians. We have a range of experiences informing that work. And I'm particularly pleased that the voice of lived experience sits at that table equally and holds strong and good voice there, and that I can be the chair of that commission working with those great colleagues. The work that we do is centred around the Contributing Life framework, where we really believe that all Australians should be thriving, not just surviving, having that access to effective support, care and treatment, something meaningful to do, something to look forward to, that we can have connections with family, friends, culture and community, and importantly feel safe, stable and secure. One of my fellow commissioners, Alan Woodward, describes our work as being that of the People's Commission, bringing the voice of people into policy development, into monitoring and reporting and evaluation, etc. Some of the big pieces of work that we are doing or completing at the moment are around Vision 2030, which I'll speak to in a moment. We do a national report looking at the system at the national level. We were part of the 9 jurisdictions across Australia that produced the National Mental Health and Wellbeing Pandemic Response Plan, and Australia was one of the very first countries to recognise the mental health and wellbeing impacts of the pandemic. We've submitted to government a national disaster mental health and wellbeing framework off the back of droughts and fires, and really developing that capacity to recognise that wellbeing across our population really is impacted in these times. We used to talk about working for the 1 in 5 Australians with mental ill health. Now we talk about the 5 in 5. Next week, we're pleased to be launching the first National Children's Mental Health and Wellbeing Strategy, an absolute first. Most of our work has always started at about 12 and up, and yet we know really it's from 0 or preconception that it's so important that we get the strategies right and the information and education right. We've been working on the National Mental Health Research Strategy, another first, the National Workplace Initiative, which is really about creating those mentally healthy workplaces for all of us, and there's a strong carer recognition in that piece of work. Suicide and Self-Harm Monitoring Project, and the National Stigma Reduction and Discrimination Strategy that I'll be pleased to talk about shortly. The work that we do, we talk about, as you would talk about, the person-centred, person-led, person-control model of care. And often people outside of health think that this is strange, that this is a somewhat novel approach and part of our health reform process. But it really is. One, it recognises that a lot of mental illness is preventable and it's treatable, and that many people will make good recovery. And so it recognises that there are many steps before we get to the health system. And key to an individual's journey is the people around them, their friends, their family and their carers. And so it's this model that we really bring to the work that we do all the time. Sorry, I've just gone backwards. During the pandemic, a lot of work was going on that you may have heard of. We had the big Productivity Commission report. This was the largest report ever produced by the Productivity Commission. We had the advice to government from the Suicide Prevention Advisor. We had the Victorian Royal Commission's report, and we've got the ongoing report of the Commission's Vision 2030 blueprint. Some very common messages coming out of all of these were around issues of accessibility, and that was around geographic accessibility, but also financial accessibility. Very strong emphasis on early intervention, early in life, hence the children's strategy work, and early in experience of distress and how we can tackle that. Big issues around workplace and workforce to be addressed, and we're working on those. A huge demand for a better integration and coordination of services, a greater embedding of lived experience in co-design of services, consumer and carer-led evaluation processes, etc., and a big push to stop just measuring activity, but to start measuring outcomes. And none of this is new, but it's important that it consistently stays on the agenda. Very early on in Minister Hunt's term as the Health Minister, he identified something that we had also identified at the Commission, that really there was no good strategy or blueprint for mental health across the country. We had lots of plans of action, but most of these were around working in the existing frameworks that we had. And so he tasked the Commission to come up with a blueprint for mental health and suicide prevention. He didn't want the roadmap because that often inferred more band-aids on the system, but actually what good should look like and what a new good might look like. And so hence Vision 2030. And we are working on that at the moment. And there's a very strong vision in that piece of work that carers are supported to look after their own wellbeing and are equipped with knowledge and tools that they need to look after the person in their care. This is a very strong emphasis on the work that we're doing. We want to see greater inclusion of carers in care planning as is appropriate in working with the team members. And a lot of this is not just cultural change, but it's educational change for the care team generally to understand the role of carers in that journey. One of the other big pieces of work was the advice to government from the National Suicide Prevention Advisor. Our CEO, Christine Morgan, held 2 roles in that regard. And it's important that we look at some of this work. It was very much informed by the voices of lived experience in that space. And people with lived experience of suicide emphasised to us the importance of coordinated care and support to them through a crisis and then the ongoing therapeutic relationship. And they emphasised the importance to them of their care network and how that it was important that we had a system that engaged and recognised their care network. But it also recognised that we needed good support for the carers in that journey as well. And so recommendation 6 in the advice to government was asking all governments across our 9 jurisdictions to work together to progress service reform to achieve an integrated connection and quality services for people experiencing suicidal distress, those who've attempted suicide, as well as caregivers who are impacted by suicidal behaviour. Really critical that we get the whole equation brought into all policy design. One of the recommendations that came out of the Productivity Commission was the National Stigma Reduction Strategy work. We often hear people say that in Australia we've done a good job at stigma reduction. And I think those of us that work in our sector are less bullish on that attitude. I think it's fair to say we've done a very good job at awareness raising. Whether we've done a good job at stigma reduction, I'm not so sure. And the Productivity Commission identified this as a key issue, and National Cabinet tasked the Commission with getting onto this piece of work straight away. So the strategy's focus is about reducing self-stigma, it's about reducing public stigma, changing the attitudes in the general community, and it's about reducing and eliminating structural stigma and discrimination to those affected by mental ill health in identified settings and those that care for them. Family, friends and carers and support people often experience stigma by association. That is, they're stigmatised because of the relationship with their loved one. And we've established an overarching guiding principle in this work which speaks to this and acknowledges the unique and distinct experiences of family, friends and carers. Some of the emerging issues that we've seen in this space are around, say, financial disadvantage, and these are complex areas to move into around eligibility requirements in the processes, which are generally designed around physical health rather than mental health. We've seen carers facing stigma and discrimination in the workplace, for example, employers not recognising the mental health carer experience and not finding opportunities for flexibility. Our colleagues at Mind Australia have done some great work in this space already, and we'll be drawing on that. In the process of the National Stigma Reduction Strategy, there will be a lot of consultation going on, and if this is something of interest to you, please go and have a look at our website. There are great opportunities to participate. We do have regular outreach sessions. There's steering committees, working groups that will be working on these many issues. We've already engaged with Carers New South Wales in this space. All the states are being engaged in the process. We do know that people say that the greatest areas of stigma and discrimination they experience are within, first and foremost, the mental health system and the health system, but then they find it within their workplace. We see structural barriers of stigma and discrimination in financial services, law, insurance, etc. So this is a very big piece of work, and the more voices we can bring to it, the better the output. We are very, a key task of the Commission is to look at data, because data really helps us to make good case to government for change and system improvement. For the last couple of years, we've been doing a consumer and carer survey in our space across the board. This was part of the 5th National Mental Health and Suicide Prevention Plan. I'm sorry for the old picture. We have done a 2020 survey that's being written up at the moment. We're not seeing good improvement, and that's been a challenge for us. But we're also seeing low response rates to our survey, and that's why we draw on important surveys such as Carers New South Wales survey to inform the work that we do. In New South Wales, we also are able to look to your experience of service survey data and the carers' experience of survey data, and this is really helpful. And those that have been in this space for a long time may recall a big push to try and nationalise some of this data, and that's ongoing, but hopefully will come through in the outcomes of things like the national partnership agreements. What we saw in the 2020 data of carers' experience of survey was some real challenges around connection, particularly when people were in hospital or other institutions, and that became a big challenge. But it is pleasing to see that most people are reporting that usually or always they feel a sense of involvement in the care, although what we did find was that this was slightly lower in Aboriginal and Torres Strait Islander communities, where there was actually less services and supports, generally speaking. COVID data would suggest that this has been a big challenge for people. Inability to visit has often meant inability to engage in conversation with the care team. And so that's something that I think we need to consciously watch going forward, is how we can make sure that our systems and services recognise the carer voice and as appropriate engage that voice where we can. Another issue I'd like to touch on, which is particularly important for me, is the work that we do through the Equally Well program. Equally Well emerged out of New Zealand, but is now an international movement that really focuses on the physical health of people with mental ill health. Sadly, what we know in Australia, like many countries, is that people with significant mental illness, with psychosocial disability, have a life expectancy of around 25 years less than the Australian population. And really this number is an unforgivable number, and often comes from poor recognition of the physical health needs of people with mental ill health. Equally Well in Australia is really working on programs with our physical health colleagues to better inform and to support, and they have some information coming out and developing consumer and carer resources around this space that are coming out later this year, including a physical health diary and guides that can be really useful for engaging in the health system for people with mental ill health. And I would encourage you to have a look at some of the great resources that they've developed and continue to develop. And again, if this is work that's of interest to you, there are great opportunities to participate in this space. I now finish up and hope that we have some time for questions, almost where I began. The team at Every Mind at the moment is recruiting people for the development of a great tool and online support for carers using a digital platform. Minds Together is the first online support program to support this carer group. It's a non-clinical program eligible for carers who are supporting people, even if that support is provided to someone without a diagnosis. And those people that perhaps, as I was saying earlier, live in that secret or silent panic and worry about someone. The literature is very strong in this space. One of the great things that came out of Partners in Depression was just how important the need is to be able to support ourselves in that journey. We know that to be a good carer, self-care is important. And so the team at Every Mind have opened up the recruitment and extended the recruitment, and we would really love as many people as possible to be part of this concept and really bring the data to the fore. We know the programs within the model work, it's just delivering it into the digital platform, which makes it so accessible to people. It would be great to meet in person, but we know there's many reasons why that can be a barrier. It can be a barrier of geography, it can be a barrier of time, and it can be a barrier of stigma. And so this may be the first stepping stone to building people's carer journeys in the mental health space. In finishing up, I'd like to recognise all of us at the moment. It is Mental Health Month, and one of the initiatives of the National Mental Health Commission in Mental Health Month is to recognise our workforce. And when we talk about the workforce in the mental health space, we talk about the 80,000 plus people that work in the clinical settings. We talk about GPs, we talk about allied health, we talk about peer workers, but we absolutely recognise the role of carers. And what we're asking people during Mental Health Month to do is to give a shout out and some recognition to those people. And if there's someone that you'd like to recognise in this context, a great carer, someone that is doing great work, please go on to the National Mental Health Commission's website and recognise and give a shout out to your particular mental health hero. I will finish up there, Elena, and hope that we've got some time to perhaps take some questions. Thank you.
That was fantastic, and also really, I mean, lots of great points and information again, but yeah, I think I'm really interested in, I suppose, the Vision 2030 focus on carers and their well-being, and also carers within that planning process, but also that, you know, sometimes, and I think you mentioned, there needs to be that cultural and educational change with services and service providers about carers and the important role that they play, or that, you know, the assistance that they can provide, and sometimes being partners in care, you know, with the health system, you know, in that way, which is great. And also really interested in the Equally Well program, particularly, I think, in the context of where we all are in lockdowns and everything else at the moment. So thank you very much. There's some questions starting to come through, so I will throw them to you as we go. What do you think those supporting carers need to prioritise as New South Wales begins to open up following this long lockdown? What do you think will be the ongoing mental health impacts for carers and for people living with the mental illness that they may be caring for?
Look, I think Norman Swan touched on this quite well earlier, is that recognition of respite. And we've lost a lot of respite service. And so I think it's recognising the need for respite, whether that's you know, a few hours, a few days, whatever it might look like. We see a lot of pent-up emotion and people investing an awful lot, but you can only do that for so long. And so it's important that we continue to bring that self-care paradigm to this conversation and find ways that we can give respite to the carers and respite to those that we love and care for. Some, you know, there's a lot of us that have been locked up together for a very long time, and so I think respite is key. We are concerned about the ongoing impacts and very mindful of those, and that is part of the ongoing work of the pandemic response plan, is that ongoing stress, the ongoing nervousness about what's coming. We don't, you know, I think Norman foreshadowed that we may go back to lockdown at different times depending on what's happening. So really helping us understand the future trajectory so that we can plan our caring with solid information.
There was just a related one just on respite. A number of programs for respite for mental health carers have shifted to the NDIS. However, many mental health carers cannot access these supports. What respite supports are available for mental health carers? So I don't know if you just anything else you wanted to comment on in terms of that one.
Look, I don't have an additional comment, but it's something that we're very mindful of, and it is very much part of the work that we're looking for in Vision 2030, building that community mental health space for all, and respite sits squarely in that space.
Thanks, thanks, Lucinda. Do you think there are parallels for carers between stigma around mental illness and stigma around dementia?
Absolutely. I think there's a stigma around the unseen, and there's a stigma around things that we don't fully understand. And this is what we're looking at and trying to tackle. A piece of work that we are starting to scope out now is Australians, and that's where dementia sits, but it's informing our work in the stigma and discrimination strategy, but also looking at the work around older Australians.
Mental health. My question is related to CALD communities. Is there any statistical data that culturally and linguistically diverse communities have more incidences of mental health challenges and suicide? What is being done for CALD communities additionally to get your message across?
Great question. So there's quite a lot going on in that space. Generally speaking, across the board, numbers are pretty consistent around mental health of it. It doesn't discriminate in the way that it impacts our communities, but it may manifest differently. People may access care differently, and that's something that's really important, is to understand the cultural differences that sit with mental ill health. As I said in the opening, our First Nations people have a fantastic insight into social and emotional wellbeing, and there's so much we can learn from there. Mental Health Australia, through the Embrace program, is doing some great work with various communities across Australia to really understand the needs and the differences in the service offerings. Head to Health, the Commonwealth Mental Health website, has some great language services and culturally informed service programs are available, and I would encourage people to go and have a look at those if that's of interest to you. It is important that we recognise the role of culture in the work that we do and in service delivery and design and delivery.
About carers in the workplace. So how do carers overcome stigma in work settings where their voice is not so welcome?
Look, absolutely. It's a huge issue, and one of the things that I didn't touch on in detail today is something that we've got out at the moment, which is a blueprint for mentally healthy workplaces, and we've absolutely recognised the role of carers in that space. The Corporate Mental Health Alliance, which was established last year and led by some of our biggest businesses, the Expert Advisory Group, of which I'm pleased to be a member advising them, has ensured that carers is squarely on their agenda, that it is an important element of the work that's being done. And I know that they've already spoken with Carers New South Wales around some of the great workplace work that you're doing. It's you can't tease these things out. A mentally healthy workplace is there for everybody, whether it's your lived experience or your caring role, and we need to make these workplaces psychologically safe for everyone.
Yeah, so I'll just give a quick plug for our Carers and Employers program, where we, Carers New South Wales works with a range of employers, as do the other state and territory carers associations across the country, to accredit carer-friendly workplaces. And there's a lot of work happening in that space as well, which is great, but obviously still a long way to go in some areas. But there are initiatives out there, and there are some really good employers that are putting their money where their mouth is and developing fantastic policies and initiatives that they're really putting into practice, and developing carer hubs and things like that and everything else, which is great. So sorry to just do a little mini plug there.
No, go for it.
Okay, sorry. How do we integrate suicide prevention initiatives? There are your efforts. There are your efforts like yours at the Commission, and then in hospitals there is zero suicide in care, but initiatives are very fragmented and not integrated.
Yes, and this has been a big issue across a lot of mental health and suicide prevention work, is the fragmentation. And I think one of the things that was most pleasing late 2019 was that governments recognised that it actually requires a whole of government approach to suicide prevention, that actually most of the levers that come in suicide prevention sit well outside the health space landscape. And so if we start at that very upstream view, That's been important. But a lot of the work we're doing around zero suicide in healthcare sits very neatly with the community work that communities are doing. Our primary health networks now have suicide prevention coordinator positions funded to be out working in communities, creating those linkages. Sometimes they happen by happenstance, but a lot of the time it takes some really hard work with people sitting down, looking at programs. We lose people at transition points, and so it's really important that we make the linkages between systems and break down that fragmentation. And I think the cultural message from government saying it's a whole of government approach has been really powerful in starting to trickle down into various organisations. And part of the advice to government was actually giving them a model for what suicide prevention might look like in social services, in housing, in the Attorney General's departments, etc., to start building that linkage concept that really suicide prevention is, we all have a role to play in whatever service we're providing.
Someone's asked if you could reshare, and if you can't now, we can post it, the link for the Every Mind again.
Oh, absolutely.
Yep.
Yeah, I'll send that through if you can.
Yeah, we'll put some information and links, and where most of these sessions will also be recorded and we put up on links on our website, so we can put any other information that's relevant that people have asked for up there as well. We've probably got time for just a couple more questions. So what is your take on the Productivity Commission responses from the federal government to date? What should be government funding priority to further improve community mental health services?
Look, I think there's been quite a lot done, and there's still more to come. At a Commonwealth state level, these are big agreements that don't seem, you know, to us sort of sitting in our houses, the relevance, but to get some new partnership agreements from Commonwealth and state around roles and responsibilities was a fundamental recognition out of the Productivity Commission, recognising that actually our community mental health services is where we need to be focused, is something that the Victorian Royal Commission recognised. It's at front and centre in the work of Vision 2030 to actually create a community mental health system. It was interesting when we started our work and we were out talking to people, there is no common understanding of what community mental health is all about. So shaping that so that we can then move and work with communities so that they understand the elements that go into that, look at where their gaps are and start to build that strong integration. We have great people working in our sector, but unfortunately they've kind of been pushed to both ends of the spectrum, to the primary care end or the tertiary end, and we need to bring back to the centre, to the community in that regard. That will take additional investment. We're seeing good commitments around that, but it will also take you know, a change in mindset for a lot of people in the way they work and operate, and that's a challenge in bringing about some of that cultural change. But everywhere we've gone, we've been well received in the programs that are being discussed, and really encourage people to be part of that conversation. To build community mental health is to engage community.
I suspect that this one would have a very detailed answer, but how can we deal with kids that have mental health issues?
So children is really important, and as I said, next week we are pleased to launch Australia's first ever children's mental health strategy. For a long time we kind of built a system that assumed it started at 12 up, and you know, if I look at you know, one of the great role models for me in this space in Mari Bashir, the former governor of New South Wales, who was a child and adolescent psychiatrist, she would say it started preconception. And so we really need to get some of these messages out there, but we need to intervene early in life and early in illness. And we need a system that is capable of doing that. And that's what the strategy is all about, is helping equip that system, not medicalising everything, but, you know, supporting parents. How can parents build up their skills and capacities? How can the education sector be part of that journey? How can the community sector be part of that journey? So I would encourage people when the strategy's out next week to have a look at that, but it is a big focus of the work coming. There were big commitments in the last budget for our children, and there's more to come.
How can we get more support for young adults around 18 to 25 years old who are considered adults but still need carer parent support when being admitted to hospital?
A really good question. And this is a challenging space. And I would say it's actually the sort of 16 to 25 group, because we've got issues around privacy and agency. We need to respect some of those, you know, the elements of privacy and agency, but at the same time, look at what's appropriate and what's needed for people. And I think a lot of this comes from some of the work we'll be doing in the stigma reduction strategy, is looking at what one could argue in some of these areas is actual structural discrimination, in the way that it is not recognising the needs of that particular young person. Now, we have to recognise their rights, but we also need to look at what good care might look like. And so these are some of the big issues that I foreshadowed we would be trying to tackle in this space.
Thank you for the very helpful presentation. How can balanced media reporting about COVID be achieved to help prevent mental health impacts? I have concerns that it was the tipping point for the mental health admission for the family member I care for. They became very, very frightened about COVID, and we were reacting to the constant media reporting.
Whoa.
How long have we got?
Yes. Look, it's a real challenge. I do personally think the media has some responsibility in community wellbeing, absolutely. If we've got a minute, my great uncle was the first Oscar winner in Australia. He worked, made Cine Sound newsreels. He worked with every Prime Minister from Billy Hughes to Gough Whitlam. And this was in, you know, last century, obviously, for the young people listening. But he had a very strong ethos that our media had a responsibility to be positive. Now, that didn't mean propagandist, and it didn't mean misleading, but he did feel that they had a role to contribute to community wellbeing. And I think there's something in that. That's my own personal view, not a view of the Commission. But I think you're right. We need that balance of perspective, because fear and negative does not help anyone all the time.
Okay. I think we'll probably finish on this last one. How can support, particularly around mental health for carers, after their caring role ends, be improved?
It's a very important question, and it's something that I do think about a lot. In the sense of engagement, the role of carers, is that these things become part of our identity. And I think that an important part of the work that we need to do in supporting carers is to help them keep their own identity balanced. I think if I put my psychology training hat on, social identity theory has a lot to play in wellbeing. And so part of being a good carer and doing that self-care is recognising that you are more than a carer. You have other identities, and nurturing those other identities during the care journey, so that when your carer role recedes either completely, which would be nice perhaps, or diminishes a little bit, you've got other elements of life to engage with. And I think that needs to be a really conscious strategy that carers, as carers, need to adopt in our self-care. Sorry, that's a bit rambly, but
no, I think, yeah, no, definitely. I think that's been a fantastic session. Lots of really positive comments coming through as well. Lots of people engaged in this session that I can see. So that is fantastic. So thank you very much, Lucy. I really, really appreciate your time, and I'm sure everyone has really appreciated your insights this morning as well. So thank you very much. And we'll put any other additional information up on the website as well after the conference is finished.